Yeah. So I yeah, where is my headphone? Okay, no problem. Yes, Amandeep Kaur, you can start now. Okay, I have to unmute you, right? Yes, Amandeep Kaur, unmute. 1 second. Yeah. Yes, Amandeep Kaur, you can start now.
Good afternoon.
Good afternoon, nurse.
My, my name is Amandeep Kaur. I'm one of the registered nurses working in this hospital ward. How may I address you?
Yeah, you can call me Maria. And my
Okay.
daughter's name is Lily. She is 12 years old.
Okay. So, how are you feeling today? And how's your daughter now? Please, may I
Yeah,
know?
I'm quite upset, nurse, because my daughter is suffering.
Oh, I totally understand. So, please, do you have any questions? Let me know. I'm here to help you out.
Yeah, the doctor has said something like a convulsive or something like that. And what is it exactly? Can you give me a clear picture about what this, I think, epilepsy or something, what it is, and what causes epilepsy? Why did my daughter get this problem?
Yeah, I totally understand your concerns. It is a very genuine question. See, epilepsy is a condition in which the brain activities get disrupted due to the brain chemicals. Electrochemicals inside the brain are there, which get interrupted. Okay, are you
Okay.
getting me? Yeah,
Yes, of
and
course.
okay, that's good. Apart from that, there are general symptoms like muscle jerking movements will be there. And sometimes after the post seizures, she can feel a bit of tiredness or incontinences. So you don't need to worry. I'm here and I'll explain you everything. Okay?
Right, a nurse. But the thing is, I am concerned that my daughter might have other convulsive seizures. And I need to know what I should do and what I should not do in case of such situations.
Yeah, I understand. So I want to discuss you regarding this thing only. Like if the seizures happen at your home, so what you have to do is lie your daughter in a straight position. Okay. Apart from that, remove any kind of harmful objects. The surroundings of her should be totally free. Okay. And make sure that nothing is inside her mouth. Okay. Are you getting?
Yeah, of course, nurse. I am able
Okay.
to
And
understand what you are saying. Yeah,
okay,
do I
one
need
important thing.
anything else? Yeah, especially I want to know what should I do if my daughter appears disoriented or begins behaving strangely.
Okay. So one important thing first after that you have to check is like she is breathing well or not. After that, if you see that you cannot control the situation or her seizures are getting more and the situation is uncomfortable, you have to call the ambulance on the spot. Okay.
Okay,
So you have to just call the emergency ambulance, which will help you out suddenly. To they'll move you, help your daughter out. Okay.
right, nurse. And when should I call an ambulance?
As you mentioned before, like if as I mentioned that if the situation gets out of control, and as you mentioned, like my what happens if my daughter gets disoriented, and what I can do at the situation. Basic tips as you have to prevent her from any harmful objects in surrounding. Make sure that she is not having anything inside her mouth, and most importantly, you have to check her breathing. Is she breathing properly or not? And then suddenly you have to call the ambulance. By these steps only, you can help your daughter can be prevented. emergency situation in emergency situation.
Okay, that's really very nice, nurse. And is there any other support that might be available for my daughter?
Yes, yes, I can really help you out. One more important information is that we are having a epilepsy foundation, which will help you out which will really help you and educate you and support you to help a recovery in your daughter. Epilepsy Foundation, on request, you can have a communication with them, the parents. You will be provided with full information about the epilepsy. Apart from that, you will be getting the contact details from the telephone book or from the internet. And by joining that thing, you will be really feeling free after getting huge amount of knowledge. And after getting that knowledge, you can easily tackle the situation. Okay.
Yes, nurse. Thank you very much for your valuable information. I really appreciate your care and kindness. Thank you once again,
Okay.
nurse.
Okay. Okay. You're most welcome. I totally understand. Like this is a very much awkward situation for you. You are very stressed, but please be calm and don't worry. She will be fine soon. Still, you have any queries, please do not hesitate to contact me. We are here to help you out. Okay?
Okay, nurse. Thank you very, very much.
Okay, thank you. So let's go through that again.
Yeah.
You are parent of a 12-year-old child, a girl child who is suffering from epilepsy, convulsive seizures, and the parents are very much worried and they're not calm and feeling a lot of stress about the condition. And they are not aware of epilepsy. So I explained them about the epilepsy, the post-operative seizure complication, and how the seizures occur. Moreover, we had a discussion regarding how to manage the seizures at home by removing the harmful objects from the surroundings. Nothing should be there inside the mouth, and checking the breathing level of the child. Moreover, we have discussed that you have to call the ambulance in the emergency situation. Furthermore, we discussed there is an epilepsy foundation which will help you out to manage the condition in an emergency situation, and they will support you and guide you for your child recovery process. And all the things are cleared and done, sir.
Yeah. So I think you were reading all these points, na? So after finishing, no need of anything else. If they ask you doubt, okay. So I was thinking what you're telling, you're reiterating these points. So you should close it with that one. Afterwards, when we say after the speaking session is finished, then you can ask any doubt if you want. So don't mix that one with other things. Okay, right?
Okay, sir. Okay, sir.
So first, let us finish the speaking and say that's very nice. Thank you. Have a nice day or something like that. Close it off. Afterwards, only you have to ask anything else. Afterwards, only you have to ask anything else. Okay.
Okay,
So
sir.
remember that. Now let me ask you. Let me tell you some things now. First one is you should know that you have to what you have to focus on. First one is the fluency. Fluency means the flow of words, word after word, word after word, line after line, sentence after sentence, paragraph after paragraph. That is called fluency. Fluency means without stopping 101 times. Continuity of speech. You need not speak very fast. You need not speak very slow. Speed is not fluency. Don't think that speed is fluency. Fluency is a continuity of speech, one word after another word after another word after another word, without unnecessary pauses and breaks. Sometimes some people speak like this. Yesterday I went to the hospital, and I went to the hospital, and doctor. So the doctor prescribed medication and some ointments and some tablets also, tablets, Panadol tab. So like this, there is some sort of discontinuation. There is lack of clarity. There is some confusion. There is everything problem there. So these things we have to avoid as far as possible. That is part of fluency. Then accuracy. Accuracy means the correctness, perfectness. Okay, perfection we can say. Or you have to maintain it properly. That is perfection. So if you maintain that perfectly, then it will be very good for you. Then apart from that, what next is you have to think about your grammar. Now, what is the grammar here? Grammar is the glamour of English language. Okay, so you have to do very well. You have to do it excellently. That's what is very, very important. Now, what is this grammar? What type of grammar we can use? Can we use ordinary grammar or extraordinary grammar? Yeah, there is nothing called ordinary and extraordinary grammar, but the quality of grammar is definitely different. So, if you say two sentences, those two sentences can be connected and made into one particular sentence. One particular sentence. How are you going to make that one particular sentence? Remember that. Okay. How are you coming? Yes. You have to know in which way you have to join these two sentences using these two sentences joining with some conjunction. For example, you come home, I will help you. You come home, I will help you. So, if you come home, I will help you. If you come home, I will help you. So, joining two sentences is very important. So, these two sentences are not separate sentences, they have some relationship. If first one happens, then the second one, it's condition. If this is the first one is the condition, if it is fulfilled, then the second condition will happen, will be fulfilled. The second condition will be fulfilled only if the first condition is materialized. If you come home, I will help you. So if you do not come home, I will not help you. That's the point there. So it has a lot of implications. So you can join two sentences using conjunctions and connectors or whatever you say. Number of things are there. Then apart from that, you have vocabulary. Vocabulary, you say start, you say commence, you say end, you use cease, cessation, stop smoking, smoking cessation, start medications, commencement of medications, follow the suggestions, take medicines regularly, medication compliance. So compliance means following something strict as it is told. That is called compliance. That is called compliance. That is called compliance. Compliance means following it strictly. That is called compliance. Medication compliance. The next one is cessation. Cessation means ceasing, stopping, ending, put a full stop. The smoking cessation, that means you are smoking 10 cigarettes every day. You should not smoke even one cigarette every day. All your life should be a forever full stop. That is called cessation. Commencement. Earlier, injections were there, insulin injections were not taken, medication was given. Now, insulin injection should be commenced. Commencement of insulin injections. So, commencement. So, these are called extraordinary words. C1, C2 vocabulary. You can use the C1, C2 vocabulary and the quality will go up in leaps and bounds. Next one, grammar over vocabulary over. Now, pronunciation. Pronunciation means how well you are speaking, how well you are understood by the other person. So, if you speak like a native English speaker, everyone can understand. But if you speak in your own, for example, if you speak in your own style, maybe you are not perfectly understood. There may be confusion. So be careful. Be careful. Right. Next, uh, whenever you are speaking, 80% of the words should be yours because this is your test. If more the patient is speaking and less you are speaking, that means you are lost. You are not speaking. How can he assess? So 80%, at least 80, 75 to 80% should be yours. Okay. But at least 20% let him speak. That's better. The next one. So 75 to 80% should be yours. Then Yeah, whenever you are asked a question, try to speak at least 4 or 5 sentences related to this. Don't just say short answer question like that. It should not be. Okay, what should I do, nurse? Okay, you should meet the doctor. Okay, why should I meet the doctor? Because he will check your daughter. Okay, what is the problem? She might have asthma. So these small sentences are not good. So try to front your explanation. Give a proper explanation so that the other person can understand very clearly. So, Amandeep Kaur, do you have any doubts?
No, sir.
Everything clear?
Yes, sir.
So, try to transform your speaking style, okay?
Okay, sir.
Okay.